Dear students, we'll discuss a topic which is very common, especially in the limb. What this condition is. Look at this. See that there is an abscess. This toe is not good. It's ischemic here. There is inflammation here. Redness is there. See that pus is here. This toe is also a little crumpled. So very typical lymphatic process here in a diabetic patient probably. So the diabetic foot with the abscess, toe is not healthy. Cellulitis in the foot extending proximally. So many problems are there in this foot. A typical of the diabetic patient. Diabetic feet involving second toe with the abscess here. You can see the abscess here, yellow area. Very typical. So micro and microangiopathies, high glucose neuropathies, autonomic neuropathy, sensory neuropathy, motor neuropathies, and that causes that problem with the arch setting, it won't be there. So dryness of the skin, that causes a problem. Pain is not there, sensation is there. Again, repeated trauma is very common, and that causes the added problem and eventually infection, gangrene, ischemia, abscess, and so on. Raised HbA1c is very, very common in these patients. And evaluation is blood level, urine ketone bodies, diabetic assessment, HbA1c, creatinine management, total count, CRP, cardiac systemic evaluation. First you have to send for culture, X-ray of the foot, whether osteomyelitis, which is very common, whether phalanges, metatarsals. Then arterial Doppler with the duplex B mode scan. B is a brightness mode, remember. Full length you have to tell, arterial Doppler with the duplex B mode scan. Then angiogram, either conventional angiogram or dynamic CT angiogram to see the block, distal runoff. Here it's a block you have to see, how proximal block is there, collateral how good it is, distal runoff is adequate, localizer block, distension block, perfusion of the limb, everything can be assessed with the angiogram. And this is the X-ray, you can see the osteomyelitis, actually typical osteomyelitis of the foot here, osteomyelitis, very typical. X-ray is a must, see that on table, this has gone. So this is the distorted bone here. Actually, this to be removed. This is the on-table finding of the same patient. So treatment is incision and drainage, removal of distal phalanx here. Antibiotic coverage is very, very important. Control, first could be culture, send for culture. Control diabetes, blood sugar with the insulin. Care of the feet. Microcellular chapel to prevent further damage. Microcellular rubber, MCR chapels, very, very important because it prevents the pressure effect and further damage to the foot and further infection and loss of foot or loss of part at the foot may be prevented by using this so-called MCR chapel, very, very typical. So answer the MCQ. Common site of diabetic ulcer is A, medial malleolus, B, lateral malleolus, C, head of the metatarsal, D, head of the toes. Put the right answer, I'll get back to you. So students, always go through my SR-based clinical methods and surgery, where everything, examination part, of course in video, how to examine is there in my book through JP Publishers, 4th edition. It contains all topic, for example, mass abdomen, swelling, ulcer, artery disease, venous disease, thyroid, and so on, all topics with the video, contain lot of photos and illustrations. I hope you have understood this diabetic foot very clearly. It's very, very common entity. Extensively asked question, diabetic foot classification also you have to tell, different neuropathies, cause, and how to manage. Insulin is the important thing, local management, surgical management, amputation with sometimes which level, everything you have to know very clearly. Very, very common entity. Remember, diabetic foot. I hope you understood this one very well. Thank you so much.